Hello, I'm Kyung-Won Kim from Yonsei University. Today, I'll present our Cvpr 2026 paper on multimodal cancer survival prediction with missing modalities. Missing modalities are common in clinical practice. For example, a patient may have pathology images but no genomic data. A natural question is, can we recover the missing modality from the available one? Only partially. Each modality contains two types of information: shared information that can be inferred from another modality, and modality-specific information that cannot. For example, patients with very similar pathology may still have different genomic mutations. Therefore, missing modality recovery is not a deterministic reconstruction problem. It is a distribution modeling problem. Instead of reconstructing everything, we should recover only what is predictable and generate only what is truly missing. Based on this idea, we propose MUST. MUST consists of three components. First, a low-rank decomposition module that separates shared and modality-specific information. Second, a latent diffusion model that generates the missing modality-specific component. Third, an inference procedure that activates only when a modality is missing. Training uses complete modalities, while missing modality handling is performed only during inference. The first step is decomposition. Each modality representation is separated into a shared component and a modality-specific component. The shared component represents information available across modalities. The specific component represents information unique to each modality. This decomposition explicitly defines what can be recovered and what must be generated. Next, we train a conditional latent diffusion model. The goal is not to generate the entire missing modality. Instead, diffusion generates only the modality-specific residual. Compared with deterministic models such as MLPs, diffusion can model multiple plausible realizations and better capture uncertainty in the missing modality. At inference time, suppose genomics is missing. We first derive the shared information from pathology. Then, the diffusion model generates the missing genomic-specific component conditioned on that shared information. Finally, the recovered representation is used for survival prediction. The same procedure also works in the opposite direction when pathology is missing. We evaluate MUSTM on 5 TCGA cohorts using paired pathology and genomics data. Whole slide images are encoded using a pre-trained pathology foundation model, and performance is measured using Herald's C-index with 5-fold cross-validation. First, under complete modalities, MUST achieves the best performance across all 5 datasets. The overall C-index reaches 0.742. An important observation is the comparison with CMTA. Both methods use bidirectional cross-attention, but MUST improves performance from 0.724 to 0.742. This suggests that the gain comes from the decomposition structure itself, rather than the fusion mechanism. The domain result appears under missing modality settings. When genomics is missing, MUST achieves a C-index of 0.716, only 2.6 points below the complete modality setting. When pathology is missing, MUST achieves 0.739, almost identical to complete modality performance. In contrast, existing methods show much larger performance degradation. These results indicate that explicitly modeling modality-specific information is essential for robust missing modality inference. Beyond predictive performance, we evaluate clinical risk stratification using Kaplan-Meier analysis. MUST consistently maintains significant separation between high-risk and low-risk patient groups under missing genomics. In most datasets, it achieves the strongest separation among all compared methods. This demonstrates that the recovered representations remain clinically meaningful. Finally, we verify whether the decomposition behaves as intended. Shared components are highly aligned across modalities, while modality-specific components remain nearly orthogonal. This confirms that a MUST successfully separates shared and modality-specific information. In conclusion, MUST reformulates missing modality survival prediction as a decomposition and generation problem. By recovering shared information deterministically and generating only the truly missing modality-specific information, MUST achieves state-of-the-art performance while remaining robust to missing modalities. Thank you.